All right, good morning, everyone. My name is Wes Gibson. I'm one of the community work group co-chairs of the Health Equity Collective. Each month, we host a virtual networking session centered around the work we're doing. And this year, to start off 2025, we have a special two-part series. Before I'll turn it over to Dr. Sharma to do the introduction and explaining the theme. However, I want to go over a couple of housekeeping items. Again, if you, what we ask is that you mute yourself and just so that we give the room over to the speakers or when someone's asking a question. Our speakers will present for about 35 minutes or so, and then we'll leave the space open for Q&A. You're welcome to put your question in the chat, or once the speakers are done, you can use the raise your hand feature to ask the question directly. We will record these sessions and email them out to the roster, and we'll also post it on Mighty Networks, which is an internal communications platform we have. If you don't know about that, we'll also put that in the chat. And then lastly, we put all of the networking sessions on our YouTube channel for the Center for Health Equity. The Center for Health Equity is part of UT Health Houston. It's the backbone organization supporting the Health Equity Collective. And without further ado, I'll turn it over to Dr. Sharma.
Hi, thanks, Wes. Good morning, everyone. It's great to see everybody again in the new year. I'm Srila Sharma. I'm director of the Center for Health Equity at UT Health Houston and also serve as co-lead of the Health Equity Collective. As Wes said, we have a fantastic networking session today with Dalberg Design and Houston Endowment. Just to give a little bit of background on why we invited Dalberg Design here today is actually we were introduced through Airlines Houston and Jennifer Hadaya, and we collaborated. We had the privilege actually of collaborating together on a grant that we are waiting to hear from, so fingers crossed, specifically around climate health along the Texas Gulf Coast. And in having those conversations and writing the grant, there's nothing like writing a grant to get to know each other intimately. And so we got to really have some very important conversations around climate health, community activation, and we all were very impressed by the work that Dalberg Design is doing. Not to mention, we also learned about the work that Dalberg Design is currently doing in our region that is supported by the Houston Endowment. So as follow-up, once we got some breathing room after submitting the grant, we said, we would love to showcase and just learn as a region. That's the whole goal of these networking sessions, is to just learn about what is happening in our region and plant some seeds in terms of where we want to go together. And so we are very grateful to Dalberg Design and the Houston Endowment team for joining us this morning. And I'll hand it over to Robert Fabricant, who is the co-founder of Dalberg Design, to kick us off today. Robert.
Yeah, thanks, Srila. And first of all, just really appreciative. So many folks joining this conversation. We're really excited to grow the network of collaborations that we are able to kind of invest in and support across the Houston area. And so this is a great opportunity to do that, and definitely appreciate both getting to know you, Srila, and having the opportunity to make this connection. I'm flying down to Houston actually tomorrow. I sold my wife on a warm weekend in Houston. Be careful coming from New York. But I'm around regularly. We're growing a footprint in Houston. Kanisha, who's on the call, is on our team. And so very open to discussing different ways to collaborate. And so hopefully this sets a good baseline for it. We do have a bit of a cast of characters joining us today, both from the Dalberg side and from the Houston Endowment. So we're going to do some quick intros. We'll do the Dalberg side and pass it over to Houston Endowment. I know, Robiel, you're not represented here, but please chime in. And then we'll jump through a few different topics and maybe just set a baseline so you guys are familiar with how we think about particularly kind of health equity in the relation to our work. So as Srila mentioned, I'm the co-founder of a design practice that sits inside Dalberg. I'll give you just a 5-minute not 5 minutes, maybe 1 minute overview of Dalberg in a minute, because I'm sure it's a firm you may not be familiar with, but maybe just handing off to Kenesha.
Good morning, everyone. I am Kenesha Allen, and I am serving as the community-based coordinator for the Greater Houston Citizenship Project with Dalberg Design. My background is education, transitioning into behavioral and mental health, and I'm excited to be here today, and I will pass it over to Tanvi.
Thanks, Kanisha. Hi, everyone. I'm Tanvi Dhond. I'm the creative lead on this project. I'm currently based in New York, but as Robert said, fly frequently to Houston, and I've gotten to know the city quite well. My background has been in research. I did a lot of work in India, mostly in women's health, and have become more and more interested in community-centered research and how can we make research a lot more participatory. And I know we'll get an opportunity to talk about that further in the slide. But perhaps for now, I'll pass it on to Erin.
Thanks, Tanvi. Good morning, everyone. I'm Erin Behringer. I am a partner at Dalberg Advisors, which is our strategic advisory and analytical business that works frequently alongside the design business. I co-lead our health practice. And so my career has been in global and public health, both in Sub-Saharan Africa, South Asia, and Latin America, as well as focused on health equity issues in the US, and really looking forward to the discussion today. I will pass it then to the Houston Endowment team.
Hi, I'm Meghna Goswami. I'm the Program Director for Civic Engagement. I've been with the foundation for 14 years, and thank you for giving us the space to share more about the project today. Thank you.
Yeah, and I'm Justine Williams. I'm a program officer at Houston Endowment. Been with the foundation for a little over 2 years, and then my background is all in the nonprofit world, mostly here in Greater Houston and in Texas. And yeah, excited to be with you all today.
Sure. And I'm Rebel Abraha. I am an evaluation officer here at the Houston Endowment. I've been here since May, so still relatively new, about 10 months. Prior to this, my background is in public health. I was formerly with the Episcopal Health Foundation, so I know Srila and Heidi and all the folks from that past life. So glad to be here.
All right, fantastic. So quickly, who is this Dalberg person? What is this Dalberg firm? Just a quick overview, and then we'll use the work to maybe dimensionalize this quite a bit more. But Dalberg is a collection of consulting firms with a variety of skill sets. But the key is we were founded almost 25 years ago and work exclusively in the impact space, primarily with governments, nonprofits, foundations, and NGOs, as well as with the private sector, but again, exclusively on social issues and social impact. In the US, we have a dedicated justice, equity, and mobility practice that really anchors how we think about the kind of structural and systemic change we try and drive through a broad portfolio of work here in the US. And the one thing I will highlight, the majority of our footprint is spread out. We're very spread out firm with most of our leadership and staff spread out, particularly across the global South. And we see a lot of intersections in working in, low resource settings outside the US, and the work we do on health equity here in the US. And Houston is a really interesting place where those things come together. As an aside, and this could be another topic we could bring to you, we did some work for Rob Wood Johnson, kind of looking exactly at kind of what are the lessons around health equity and health systems that we could kind of gain from other countries as models or exemplars for the US to consider. So we did a report and research on that last year. Health equity and equity in general is at the foundation of all of our work. And we bring a gender and racial justice lens to all of the analysis we do and all the research and program and intervention design that we work on together with our partners. So that's who we are. And obviously, we're fairly new to the Houston environment. We've been working hands-on for about the last 18 months. And in that work, we've been particularly focused on human-centered design. And so I want to, as the person who leads that practice and that business, I'm just excited to talk you through it a bit more today And we'll use the example from the work in Houston, as well as another example from our public health work. But I also wanted to highlight that we're going to give you a little preview of this towards the end of the session. We're going to reserve a couple of minutes after the Q&A. But we will be coming back in February and look at what we're learning from other stakeholders in the US who are thinking differently in different ways about that intersection of health inequities and climate change. So Erin will be leading that conversation. So we're delighted to have a doubleheader, and hopefully, this first session builds some interest for you joining us in February, on February 20th. So here's the agenda: a quick overview on HCD and what it means, human-centered design. We'll pass over to the Houston Endowment team to introduce the purpose and mandate of the Community Citizenship Project, and then Tanvi and Kanisha will be talking a little bit about the design and research approach we've taken. Sorry, I'm working on a little cold. And then I will kind of pick it up and talk about how we apply some of those same ideas and approaches to some public health work in Tucson. We'll take a break for discussion, and then again preview the next session that we're doing. So human-centered design, the key here is to understand that it is a process that's been used in health for a long time. And what we really try and do is start by looking at the lived experience of stakeholders. Often that's patients and community members, but it can be other stakeholders, it can be community health workers, it can be other decision makers, and trying to think about how the health system and how health processes information, tools can be better designed and adapted to their day-to-day experience, and how those improvements can ultimately drive health outcomes. And we use an iterative process. So while there's a ton of in-depth, mostly qualitative and some quantitative research we do, we're constantly funneling that into a process of co-design to try and figure out, well, how are you going to use that to bring new ideas and approaches into the system? And how are you going to test those? Because the health system's not the most flexible. Test those as you go, not just at the end. So that's kind of the core model. And we work all the way early on, trying to bring the community into how we think about the assumptions and hypothesis that drives design, all the way through multiple cycles of this process to inform not just what we're learning, but how we're converting that learning into actionable ideas. And ultimately, we feel that is a great way to start to build some ownership towards how we're going to scale up and bring those solutions to the communities that we're partnering with. There's a strong intersection there between that approach and strengthening equity. As a firm, we're primarily working in low resource settings, whether it's in the US or abroad, and we're constantly trying to understand how to involve community members at every stage of the process, and how to move from thinking about the things we work on and the problems we work on as something that is focused on needs and deficits, but much more building on strengths, relationships, and assets in the community, that through the process strengthens the design skills and capacities in the community, builds new collaborations and connections, which you'll hear about a bit in relation to the Houston Endowment, and amplifies the sort of strength and resources the community has. And so we're hoping in that way, in addition to the direct immediate benefits of some of the solutions we collaboratively develop, that there's this broader sense of collective value in terms of how the community feels empowered through the process, and particularly in health systems where that's such a huge component. People feeling that they don't have that agency, and that perception and that process hopefully builds trust and creates a stronger sense of empowerment within the community, the diverse communities we work with. So that's kind of the broad frame. It takes often a few conversations to bring it to life. So we're going to go through two stories primarily. We're going to start with the work we are doing in Houston, even though it is not focused directly on health equity. There are some intersections that have come up, and then come back and fold it back into a public health example. And with that, I'm going to hand off to, I think, Meghna maybe to do a quick intro on the endowment and start to talk through a little bit what the project is about.
Sure. Thank you so much, Robert. I will provide just a quick overview of the Houston Endowment and our priorities, and why we decided to adopt the human-centered design approach, especially in our work around naturalization and citizenship. And then I'll turn it on to Ghislaine to provide an overview of the project. The Houston Endowment is a private philanthropic entity that's based out of Houston. We have three big priority areas. Our work on pre-K to 12 public education, we work mainly with school districts and teachers. Pipeline is a big thing that we are working on. We are getting into the community college space. That's our strategy is kind of evolving in that space. The second big area of support is our work on civic engagement, and that's the team that Ghislaine and I are part of. Civic engagement can be very broad, so we have three priorities within civic engagement. One is our work on voting and democracy. The second is our work on immigration and naturalization. And then the third is our priority around nonprofit journalism. And then the third priority that Houston Endowment has is our work on arts and parks. You all know Houston is such a diverse community. 1 in 4 people in our community are foreign born. And within the foreign born community, we have around 360,000 people who currently are on green cards eligible to take the step towards citizenship. They just haven't taken that step given multiple barriers that folks typically face in that process. We do fund pretty extensively in the naturalization space. So we fund direct legal services, a lot of organizations that provide social services that help people move along the pathway to citizenship. We do fund policy work as well as research work as well. And then over the past year and a half, as we've thought of how can we intensify our work in this space and how can we have more impact, we recognize that it would be really helpful for us to, one, take a data-driven approach to understand which are the communities and neighborhoods in Houston where there are huge eligible to naturalized populations. And then secondly, how can we be more deliberate about centering communities in our work by not just embedding ourselves in the community, having a lot of listening sessions to understand why people are not taking the step towards naturalization, but also co-design interventions with community partners. Anyway, so we went through this search process to figure out who the right partner would be as we embark on this project. And we've been very, very fortunate to have partnered with Dalberg Design. They've been just fantastic to work with. And I'll now pass it on to Ghislaine to share a little more about the work.
Yeah, and just to add to what Magna already shared, we have this priority around citizenship, and it's because we know that if we can get more people to access citizenship, it'll make a big impact because we know there's several benefits of citizenship. Of course, there's the one that people know about the most probably is the right to vote, but there's also benefits around, protections from different changes in immigration policy. Citizens are able to, sponsor family and offer legal pathways for family members here in the US and abroad, which is a really big deal here in Houston because we have so many people in mixed status homes. And then of course, citizenship also offers better access to really important benefits around, education, disaster recovery, which is a huge deal here in Houston, and also really important health benefits, especially for older immigrants here in Greater Houston and of course across the country. And so as Magna shared, we have over 360,000 people in Houston who are eligible to become citizens but have not taken that step, which is a huge number. And so we have really been wanting to figure out how do we reach all of those folks? What is it that's really preventing them from taking that step towards naturalization? And so that has been a huge goal of this project, is really going and talking directly with community members to hear from them about what their unique challenges are, what are their perspectives about citizenship, and what could get them to that step to be able to apply for citizenship and have access to all of those benefits. And so this project, has really been important in helping us kind of refine our strategy, help inform our grantee partners and the project partners I know it's already been really helpful in helping kind of shape and refine the strategies that our nonprofit organizations are using to better reach community members. And we're really excited to kind of enter into a new phase of the project where we're actually going to be piloting some of the solutions that community members came up with during the phases of the project last year. And so with that, I'll turn it over to the Dalberg team so they can delve a little bit more into the project itself.
Yeah, thank you. And we're going to just give you a little taste of the process we've taken. And as part of that, highlight how equity has been centered at every step. And I just wanted to highlight right from the beginning, even in the governance model, we tried to think hard, in addition to working with the endowment and their trusted network, how do we bring together the right set of advisors, given the diversity of communities we're engaging with, and not just communities by identities, cultures. And so we put together not just an advisory council, which is a sort of, a conventional structure, and in this case, one that includes at least one strong stakeholder from the health community, Dr. Caracostas from Hope Clinic. But we also augmented it with community amplifiers, folks who are working more at a grassroots level. And in addition to sort of adding that perspective to the core members of the advisory committee, we also engage them regularly to take what we're learning out to various communities, whether it's folks with differing abilities or other things, so that we can vet any assumptions we're making, any learnings through that filter of both the core team members and these amplifiers. So that's one way that we continue to steer this. We actually have a meeting of the advisory committee next week to sort of walk through the pilot priorities, for example, and again, have them help shape both what those priorities are and how we're engaging different partners to deliver on those pilots. Here's an overall timeline. It's a 2-year project. We're very blessed with the level of resources that the endowment has provided for us to work both with the community directly and support community partners through this design process. We started in September. By the end of last year, we had kind of completed most of the community research and prototyping, which we'll show you. And we're now laying the rails for the pilot planning. And towards late summer, early fall, we'll complete kind of the evaluation of what we've learned. I'm going to pass over to Kanisha to kind of pick it up and walk through a little bit kind of the focus and process we've been through for the participatory research.
Thank you, Robert. So we embarked on a very collaborative process with the Houston Endowment, our other partners on the project, Wellspring Consulting, in addition to our advisory committee to really take a deep dive into all of the research, into all of the data, and really look at the geographic areas that have the highest propensity of immigrants that would likely naturalize. And so we were able to really kind of pare it down and narrow it down into these 5 geographic areas, in addition to the specific neighborhoods within those areas that are listed here. And so those 5 geographic areas: North Houston, Greater East End and East Harris County, Southwest Houston, Northeast Fort Bend, and Montgomery County. And within the respective neighborhoods, we have had the honor and pleasure to work with an diverse range of community members from various backgrounds: Latine, East Asia, South Asia, refugees throughout West Central, Eastern, and Southern Africa, individuals from the Middle East and North Africa. So we have really had a very inclusive and diverse representation of immigrants and refugees that have come from these various geographic areas. And then going to the next slide, the beauty of the human-centered design process is that it is very participatory and collaborative in nature. And so our various community members that have participated in the various community research sessions have really formed and framed the entire process. Our research sessions were held in trusted spaces with our collaborative partners in community centers within the agencies themselves and faith-based organizations to ensure that community members felt comfortable, right? To ensure that they knew that they were leading the process, to ensure that they felt trust. So it really took for the collaboration of our community partners to help kind of foster and build that rapport with the various community members that we spoke with. And so our conversations that took place all throughout last year were held very conversational style and not interviews. We wanted to make sure that the knowledge and the lived experience of our community members that participated were front and center. We wanted to make sure that their realities, their lived experiences were in ways that we held space for them. And we conducted that in those community research sessions in ways to make sure that they knew that the process was collaborative and that their voices and their experiences would be heard in very real ways that really kind of highlighted their overall lived experience. And then going to the next slide, this gives an overview of what those community research sessions looked like. The research sessions were 2 hours in length, and they were designed to be an end-to-end experience for participants. And they were divided roughly into 4 chapters that corresponded with our learning agendas. And so the first 10 minutes, we introduced ourselves as the facilitators, allowed them opportunities to introduce themselves, to really ground the space, and for us to familiarize ourselves with them and for them to familiarize themselves with us. And then we went into talking a little bit about just their overall citizenship process up until that point, just kind of their daily life. Again, to build that rapport, to build that trust. From there, we transitioned into very specific conversation and dialogue prompts that highlighted and talked about their immigration journey. So learning about their journey to the US and their present day experience. From there, the conversation led into more about the communities and their support system. So agencies that they may, be clients with, faith-based organizations in which they have maybe developed their own rapport, and talked a little bit about those experiences there, which helped us really kind of form and get a better understanding of like a collective landscape and the resources that they utilize. And then we concluded the research sessions, on a little bit of a lighter note and talked about their long-term and short-term aspirations for citizenship. Wanted to learn a little bit more about their visions for the future and how, the process up until this point has framed that for them. So that's a little bit about how the research sessions were conducted, and I will pass it over to Tanvi to delve a little bit more into the nuts and bolts of those research sessions.
Thanks so much, Kanisha. And just to add a little bit to what Kanisha was saying, we also recognize through our sessions that talking about your immigration experiences can be quite personal. And so wanted to make sure that the conversations were directed by community members themselves. They had the agency to lead the conversation. At any point, if they didn't want to speak about certain things, we didn't push the agenda and really took input from the organizations that we were collaborating with on what are some of the welfare protocols we need to set in place so that this conversation doesn't re-trigger or go into places where community members are not comfortable. The following 3 slides actually just talk about how we synthesize learnings from these sessions and how we progress that in our process. So as we know, the immigration experience can be so diverse, but we did begin to see a few patterns, especially relating to how community members look at naturalization. And we realized that these patterns actually fit in 5 groups based on your age. They also depend a little bit on what your role in the family is and also on your gender. as well as the immigration status you arrive on. So we realized that arriving on the refugee status was quite different from some of the other immigration statuses that you came on, and a lot of times posed multiple challenges in working towards naturalization. We also realized that younger community members have different priorities as they relate to work, education, and perhaps naturalization might not be completely on top of their mind, but it's definitely a future goal that they want to work towards. We realize that primary earners for families have so many competing priorities right now and want to like achieve financial stability for their families as a priority. And even though they see naturalization as a goal that unlocks so many things for them, it can be a little more challenging for them to find the time to prioritize it. We also looked at primary caregivers. A lot of the moms in the families recognize naturalization as being such a helpful goal for not only themselves, but also their children's futures. But they also faced a few challenges in being able to get the accurate information, also having to manage multiple responsibilities and pursue this as a goal. And then finally, when we looked at community members that were above the age of 60s or retired or had retired, language becomes a big challenge. Also, finding communities that make you feel belong in your neighborhood, in your community, can come in the way. And then also learning can be a little more challenging for them. But from so many of our research sessions, we found that peer-to-peer support, the role of your teacher in the naturalization classes, can go such a long way in making them feel motivated. And so there's really a breadth of experience as it relates to naturalization that we wanted to capture. And we wanted to make sure that anything that we do in the naturalization sphere caters to all of these varying needs. And so what we did with those 5 patterns, or actually we developed 5 characters, each one representing this different experience. And then we built a story around these characters. So for example, one character was Miguel, and he's really portraying the story of a primary earner for his family. He's been eligible to naturalize for 15 years. He thinks that definitely wants to become a citizen in the future, but currently is really trying to make sure his family is financially stable. And then we charted out Miguel's story from when he arrived to the US, from when he became eligible to naturalize, and where he is in his journey right now. And we actually took these stories and put them out to community members for our next research session to get their feedback. And what was really amazing is so many of the community members, when we put out these stories, would say, Miguel actually reminds me of my dad, or this person's story actually reminds me of my uncle. And they were really able to interpret and make these stories their own, or relate them to someone in their family or someone that they know of. And that really unlocked a new level of thinking about how do we now design a solution for this person. So knowing Miguel's full story, knowing that what his experiences might be, because I know someone in my own circle who's gone through this, what might Miguel need to take the next step towards naturalization? And so we asked community members to think of these ideas by themselves. So people wrote these down on Post-its, as you can see in the first picture. But then in the second picture, we brought all these stories together because so many of them had common patterns or common threads. And it was really powerful to see how many of these ideas overlapped. And then we took those ideas and some of the threads that were in common and built them out even further. So if you see the last picture, we go from like a quick idea that someone writes down on a Post-it to how does this actually work? So for example, peer-to-peer support was such a recurring theme that came up. So how can we connect Miguel to other Miguels in the neighborhood or in his community who are also interested in naturalization? And then we kind of write out about what are some of the spaces in which Miguel might like to meet his peers. When does he have the time? What kinds of sessions, or how would we like to engage with Miguel to make sure that he feels supported through his naturalization journey, and really adding all of those details. And so the first stage that I just talked about was understanding the naturalization immigration experience. The second stage was taking these ideas and developing them into full-fledged concepts that we tested with communities again. And now the third stage is actually pilot planning. we've had so many sessions with the CAC members, taken their advice on some of these concepts, also taken feedback from community members, and have arrived at 3 pilots that we think are really desirable and will push the needle for the naturalization ecosystem in Houston. And over the coming months, we're connecting with organizations that can take these pilots, run them forward, which communities we want to test them with, as well as just understanding how do we measure and evaluate the early impact of some of these pilots. Let me pass it back on to Robert to talk about our next project.
Yeah, so I'm going to just close by bringing this back to, hopefully that brings the process to life. And, offer some reflections on maybe some of the ways you already engage community members, some of the qualitative research work you might be doing and where this could enhance that. I'm just going to bring it back to the world of public health with one short story, and then we'll go to discussion. So the one thing I want to say is we're strong believers that there's a lot of complementarity between the way we think about community engagement, the way we work through a design process, the type of rigor we bring to it, and the public health counterparts that we've worked with. And this is part of a long tradition of collaboration. We actually built out a site called Design for Health with the Gates Foundation and some other stakeholders to try and tell that story. There are some common values, both being very patient and user-centered and both being very outcome-driven. And then there's some kind of different balances of in terms of emphasis, whether it's a consultative process that might bring the community in at discrete points versus the kind of participatory and longitudinal process you heard about, whether it starts with some very specific health issues or more looking at issues in the lived experience within communities, whether it's got a focus that stays grounded on specific clinical needs and health concerns, or is looking at the holistic context of people, whether again they're patients or health workers or other folks in the system. How much there's a focus on a very repeatable process versus what you heard, which is a bit more adaptive and iterative. And finally, how much is it sort of expert driven, but versus community led. And so we brought this same process into Tucson, working with the Pima County Health Department. And here the issue was rebuilding trust with Latin A, O, and X communities in that area related to both COVID vaccine uptake and usage amongst particularly folks who can become pregnant, but also broader kind of connections between the community and the clinic. And so we did the same sort of work that Tanvi just described. We mapped out journeys, we mapped out the ecosystems, and we did this, if you look in the lower left, in a very collaborative way, kind of looking at where people in this case would place their money on different points of intervention at different places where they feel challenges. We went through a co-design and prototyping process looking at what could change in the clinical environment in terms of process and decision support and integration, and also what could be leveraged out in the community. And again, went through a series of pilots where we tend to do a lot of the early work as we are in the Citizenship Project, kind of thinking through how a pilot could work, but then collaborating very closely with community partners to lead and adapt those pilots to the communities they serve. And in this case, we had a clinical system, a federally qualified health system called MHC, that was taking on responsibility for integrating things like promotoras much more deeply into both the onboarding process for patients into the clinic, but also the decision process around their situations. And then we were also working with a series of partners, particularly in the literacy space, to look at health literacy and how they could expand their footprint there. And we were fortunate, we actually had 3 evaluation partners. There was an organization, a consulting firm that does behavioral science called the Behavioral Insights Team, 2 academic partners, one more looking at the implementation science and one looking at the community outcomes. And so we've had some papers and other things presented at NACHO and other places around this. And we also got a lot of feedback along the way, particularly from the promoters who participated, as well as some of the community participants. And we can share a bit more about that. But again, very much the same process. And if you think about what you were hearing around motivation, around trust, around kind of literacy and navigating something like citizenship, it's not hard to see where the parallels are. And finally, a quote. We had a lead who ran the Advancing Health Literacy Program, who's now an advisor with our team, working on the Citizenship Project and other things that we're doing. And she led the charge to help us not just complete this specific program, but also think about how something like human-centered design could start to become a capacity within a public health department, which is, as you can imagine, is something that's pretty rare. I'm going to close by just putting up a list we've had the privilege of applying this in a lot of low resource settings to a range of health equity issues, whether it's male engagement, something that Tanvi led around sexual reproductive health and nutrition, whether it's mental health, whether it's broader systemic strengthening issues around disease surveillance, pandemic response, community health workers. We've collaborated with Erin on a lot of this stuff. We've done this stuff both in the US and in a variety of low resource settings around the world. So we're constantly looking for where those connections are. All right, I'm going to stop here. And hopefully that gives us about another 15, 20 minutes for discussion before we close with a little bit of a preview of our next session. So I haven't been able to see the chat as the person who's doing this presentation. So happy if there are some questions that people want to put out there, that would be great.
Yes, go ahead, anyone, feel free to either type it or use the raise your hand feature. And yeah, don't be shy and let's step forward.
Robert, I can kick us off. Thank you.
Thanks.
Great presentation, everybody. This is phenomenal work. One question I had, and this was, I think, Tanvi, you were presenting. How are the stories usually shared beyond the community? Do they go beyond the community and from the pilots as well? What does that look like from does Dalberg then implement those pilots that are coming out? And then how does that part of the process work?
Thanks so much, Sheila, for your question. So perhaps there's two answers to this. So I think one, maybe you're asking also just how do we share back some of these research findings? So for that, we've actually shared a lot of the research findings with organizations throughout the process, just sharing what we are learning from the community, where the pilots are. And we're actually trying to get their feedback on how do we share this beyond just the organizations, even to the community members. And we recognize there's an added layer of translation there because our findings as they stand right now are research findings. So we know that packaging them, making them accessible, and also having in our consent, we did not have consent from community members to reach out to them directly. So I think our organizations who helped us reach out to these community members will be critical in playing that bridge role. And that's something that we are still trying to understand. The second part of your question, which was about how do these pilots now ultimately go out into the community. From our research process, we've been looking at some of these organization partners who are doing such incredible work in the community already, and also looking at our relationship with them throughout the past year, and asking them their availability, willingness, enthusiasm to take on some of these pilots. We are still in the process of figuring out those conversations. We know that particularly at this time of the year, organizations may be still planning what the coming year looks for them. And so once we have their availability, we are hoping that us, along with these organizations, can pilot these programs for the next 7 or 8 months until August. And then at the end of that, analyze some of the early results and some of the early measurement that we have to then make a report. And then again, share back with organizations, community members as well about what worked, what didn't work before the next stage. Does that answer your question? Let me know if there's any other detail.
I mean, because immigration and citizen, I mean, these are also very political issues. How does this reach our policymakers, legislators? Maybe that I should have been more clear.
Yeah, let me add two thoughts, and we don't have a simple answer to your question. The one thing I want to say is a lot of the pilot partners have been along with us through the research process. And that trust building is really critical because they already trust that we've really been in the communities alongside them and really understand and have that context, and they also are comfortable with the way we work. So we're not just pulling them in to say, hey, now pick up this pilot. That trust is there. They've heard the things practically through the research because they've been in those rooms, but also they've become comfortable with the process. So what we create are playbooks and other things to give them a starting pad, but we're really open. Part of the learning agenda is learning about their process for trying to adapt these pilots to their context and community. Back to the policy. Oh, go ahead, please.
Oh, sorry, Rob. Yeah, I was just going to add to touch on the policy piece. So as Tommy shared, we have shared these findings with community partners and with citizenship service providers and anybody working on citizenship in Houston, which does include our city and county partners. And so they've been part of these conversations. We've also presented some of these findings at a national conference that just happened here in Houston. And then also we actually had a direct meeting with officials from USCIS, so the federal agency that manages the citizenship program, and spoke to their national team and Houston team directly to share with them what we're hearing from the community.
But we're also aware that political environment's changing. So the pilots themselves, even in those conversations, we're trying to make sure that we're adapting to how any of those shifts. Okay.
All right. Our next question comes, and I'm from Nabila, and it says, I'm a licensed clinical social worker with a passion for health equity with some experience in the space specific to Texas. How can I get involved with your pilots?
Yeah, that's a great question. And I think right now we're still shaping kind of how we're going to go about the pilots, and because they're going to be, and what the scope is and who the partners will be in place. So it's probably a question that's easier answered after that. We're definitely very excited to both work with them and the networks they have to start to test out and see what of this is both impactful and sustainable at a broader scale. And we're certainly looking for diverse viewpoints to help inform that. As you saw with the geographic focuses that we selected for the research, we are looking at very specific areas where we want to make those commitments so that we can learn as much as possible. But we're always interested in having follow-up conversations and seeing where it might intersect with work that other folks are doing. So we'd be very happy to pick that conversation up. And I don't know what the process is for making direct contact through this, but happy to pick that up once we've, in the next couple of weeks, got those core partners in place. And then I would say beyond the pilots, everything that we're learning, we would love to layer into the ecosystem of community-based partners that are both working directly around immigration issues, but also, as we know from Dr. Karakostas and others, that at that intersection. As we know, for example, for some of the archetypes that Tom V brought up, health benefits and realizing health benefits are a really critical driver for folks, particularly folks, a little further along on the aging spectrum, like myself. Getting health benefits and qualifying for them is one of a clear motivation for taking that step.
Peter, I see your hands up.
Hi, Peter Durand, longtime fan, first-time caller. I've known Robert for 20-something years. So my question for you and the team is, I've participated in sessions like this, including with UT Health, School of Public Health, in places like rural Kenya or the Navajo Nation or the back rooms of a cafe in the cities. What are some unique challenges that you found and opportunities and benefits that Houston has that you haven't seen in other areas?
It's such a great question, Peter. And I want to say that on a personal level, I've become quite a fan of Houston. And as a New Yorker, that's a born and raised New Yorker, that's saying a lot. It's a very, very different city. I mean, I think the first thing I will say, and I would love to hear from Tanvi in particular, given your diverse experience and Kenesha as well. It starts with having a stakeholder like the Houston Endowment that is so deeply committed to long-term impact and change and community engagement, and has such a deep set of relationships. So that was, to me, it just opened doors that and allowed us to build on a base of trust and to understand and I think for the community partners to know that the commitment to long-term to benefiting from this work is really huge. So I would say that's been amazing. The diversity of the cultures here and the connections that has to work we've done all over the world, I think has really astounded everybody. And the degree to which the Houston community and many stakeholders in the community are so deeply invested in supporting the diversity of the city has just been amazing. So I'll say I get inspired when I'm here, whether it's in the work or going out to restaurants and just kind of intersecting with so many of the partners we work with. So for me, it's been a real pleasure that way, and feels like a very unique place in this country and in the world kind of right now. Yeah, Tanvi, personal thoughts there.
Yeah, that's such a great question. Having done these research sessions also in like so many parts of the world, something that stuck with me from our research sessions over the past year in Houston has just been we've s- we most of these sessions are group sessions, right? So there are at least 3 or 4 people in the room, and we try as much as possible to ensure that community members have like some familiarity with each other, but oftentimes their journey that brings them to the US is so diverse, and in all of these sessions I've always been struck by, even with those diversities, how quickly it is for them to find community in each other, to share. I also left my home. This what you're experiencing feels very similar to me, and I think just like seeing those connections develop, finding community in each other was so powerful. And the other thing that struck me was we've partnered with a lot of organizations that provide naturalization support, have been doing this work for so many years. And us entering the space as outsiders, we're always cognizant of how that can stir up some things. A lot of organizations might look at us very tentatively, and also be like, just have a lot of questions about what we're doing here, why we're doing here. And it takes some time to build that trust, but what also stayed with me was just how open and enthusiastic so many of these organizations were towards our partnership. Like, they're so busy, there's so much that they have on their plates, but every time we showed up to these organizations, they were like so generous and abundant in their partnership. It's been really inspiring. And the
Well,
food.
just add that we've had some incredible moments with the advisory committee, because almost all of them come from a first or second generation immigrant background themselves. And so even though many hold senior roles in the community, their personal connection to the topic and their passion about it and their willingness to share their experience has been really outstanding.
Robert and Tanvi, I think you both kind of summarized really kind of the highlights. Myself being new with Dalberg and, new to community-centered design, human research design, and then learning a lot more about some of the other projects that Dalberg has implemented internationally, and then connected it, those with this Houston-based project. I think a key highlight that has stood out for me is that, as Tanvi mentioned, once our community members have established and formed community within the research sessions, how candid they have been, right? How vocal they've been about their overall journeys and experiences, and that really has helped us really get some really great insights and really great details to help really frame this research and present it in ways that are really authentic and genuine, and really capture those experiences of the community members that we've had the honor and pleasure to work with.
So I'm going to cut us off here because we did want to do a little preview and sense checking for the next session, but I do want to emphasize, and I can work with Wes and Srila to figure this out, very open for any follow-ups to handle questions by email or connect with folks. We know that this human-centered design story is something that people are still learning about. So any way we can help on that process would be great. So I'm going to actually now hand it over to Erin. She's just going to give you a little bit of a sense of what we have ahead.
Thanks, Robert. And hi again, everyone. This will feel like a bit of a pivot from human-centered design. But at Dalberg, we work across a number of issues and methodologies to really center health equity. And so another topic that we've done a lot of work on in recent years is the intersection of climate and health equity, which I imagine is on many of your minds. And so we're looking forward to joining you all again for another session on February 20th, which will be focused on addressing health equities that are amplified by climate change. And so our plan for that session, we wanted to preview our plan today and then get your input, honestly, to hear what's top of mind for you all as we design that session further. But our hope is that we can use that session to really share with you some of the ways that we're seeing across our clients and our partners that they are adjusting their own strategies, their own practices, their own programs in order to be more climate resilient, and especially how they're doing this in a way that really centers health equity. Because I think we all know that oftentimes it's kind of those that are most in need, those that are kind of have the least access to the health system, et cetera, that are actually most affected by climate shocks. I think as we are watching play out live, quite frankly, at the moment with the fires in LA right now. So our plan, what you see on this slide is some of the examples of clients we have partnered with in the past and supported that have looked at this kind of nexus of climate and health equity. And we can share a few examples in more detail when we meet. Some teasers are that we've worked to develop a model that supports cities to more proactively anticipate and react to climate threats through better data, machine learning, satellite imagery, and then put in place plans that really center equity as the health system and health actors respond to climate threats. And then we've partnered with a number of healthcare providers to really think about where there are opportunities to make operations more climate neutral while also driving health equity within their health kind of system, be that an individual practice, a hospital system, et cetera. So just a bit of a teaser. I think what we were hoping to do, we have 2 minutes left, is just hear from you. You can put it in the chat. That's probably easiest. But if anyone is passionate about this and wants to come off mute, would welcome that. But just hear from you if there are specific topics that are of greatest interest at this climate and health equity nexus. And so there are a few on this slide just to prompt you all. But essentially, is it thinking about the implications on your work from climate threats? Is it thinking about planning for climate threats and climate change at a city level, at a health systems level, at an individual provider level? Are you interested in financing models? Is it more intersectional with other issues like housing, food security, et cetera? So I know we only have 2 minutes left, but that was both a preview and then would love any input from you all so that we can tailor the examples that we bring to you on February 20th.
I had an idea too that we could do is we'll be emailing this out to the whole roster. We could add a survey if you'd like as well to get, if you want, also with other people that might be attending, I'd be happy to set that up for you as well.
Yeah, that's what I put in the chat, Erin, if that's of interest.
Yeah, that would be great. Thank you all. And thanks for those that are making suggestions in the chat as well. But yeah, we look forward to that session and to your feedback in the survey. So thank you, Wes and Shrila, for suggesting that.
Great. Well, thank you so much for coming today. Again, we'll email the recording out, and then Robert will coordinate follow up if you'd like. Also, in that we can put your email, however you want to do contact for any follow up for Dalberg and the Houston Endowment. But yeah, again, thank you everyone, and have a great Thursday. And thank you again to all our speakers.
Yeah, thanks so much for creating the space, and it was great to connect with everyone.
Thank you all.
Take care.